Welcome to Podcast by TechNation. This is a series of podcasts focused specifically on the biomedical and HTM industry. Episodes are added monthly. Listening to each episode is eligible for one continuing education credit from the ACI. At the conclusion of this episode, you'll be able to access a link that will take you to a quick survey. You'll be able to download your certificate once you submit the survey. Before we begin today's podcast, I'd like to invite you to save the dates for our upcoming HTM mixers. We'll be in Milwaukee on July 14th and 15th, and in Kansas City on November 9th and 10th. Please visit htmmixer.com for details, registration, and our steps to a safe and clean meeting environment. Podcast by TechNation would like to thank our sponsor, Accruent. Accruent's intelligence for the built environment aims to improve operational efficiency, regulatory compliance, and the quality of patient care, and to drive gains in performance and availability of healthcare assets, including facility and biomedical equipment. For more information, please visit accruent.com. In this episode, we are joined by Al Gresch, David Braeutigam, and Mike Myers. Gentlemen, you may begin whenever you are ready.
Welcome, everyone, and thank you for joining us for today's podcast. Today's topic is healthcare and HTM just handle a pandemic. What trends are coming next? My name is Mike Myers, and I'm a senior sales engineer for Accruent, specializing in the healthcare vertical. I'm joined today by our industry expert, Al Gresch. How are you today, Al? And who else do you have with us to discuss today's topic?
Hey, Mike. Thanks for the intro. Today, we've got David Braeutigam, and David I've known for a very, very long time. He's been in the industry almost as long as I have, over 35 years. Spent some time in the armed forces, served at Walter Reed Medical Center, and after that was a biomed, a manager, and system director at Baylor for a number of years. And David is now teaching, consulting, and writing for HTM. I'll do a shameless plug for what we just talked about, David, the Tales of the Biomed, part 1 and part 2. Some great funny stories from the industry. So welcome, my friend. It's great to have you.
Well, thanks for the intro, Al, and thanks for the plug on the book. They were fun writing.
Right. Excellent. Thanks for joining us today, David.
Thank you.
I'm really interested in hearing your thoughts on today's topic. So as its name suggests, we're just coming out of a worldwide pandemic. It's brought lots of challenges and changes to healthcare and the HTM industry. So we'll start with you, Al. Did anything good come out of that?
Yeah, thanks, Mike. I actually think it did. The things that jump out to me most are, first of all, I saw it as a technology accelerant, and we're going to talk about some of those things in our discussion today. But you think about where telemedicine was. Telemedicine technology has been out there for a time, but very, very slow in gaining adoption, both within healthcare systems for patient populations, but also insurers, right? We weren't sure how things were going to get reimbursed, so there were challenges on that side. And with the pandemic, they had to figure it out, did figure it out. And I can tell you that personally, I had a couple of e-visits during the main part of the pandemic, where you really avoided going into the doctor unless you absolutely had to. Another thing that I've seen, and I've talked to a number of folks, leaders in the industry about this as well, just the overall cleanliness and adherence to infection control processes, policies, and procedures. I've seen over the years that in the industry we haven't really been real good at that, and people are taking a whole different approach to that level of cleanliness and infection control more so than they ever did before. David, what are you seeing? What are your thoughts on that?
Well, I agree. I think what you said about telemedicine definitely hit it on the nose. It's been around for a long time, and I think finally we had to have something force the needle to get people to adopt it more. And the pandemic gave us a reason to adopt it more. So I agree with that. With me teaching now too, it's like you said, to stress cleanliness and just making sure that infection control is up to speed. That's one thing I've stressed with my students. I go, your biomeds, you have to basically assume everything is dirty, right? From an infection control standpoint. So, there's really nothing the pandemic really changed from that viewpoint. You just got to be more vigilant on what you're doing.
All right, great points. Moving on to the second part of our discussion here. So what's next? What can we expect in the days and months and years to come?
So I'll start us off on that, and I don't think that there's any secret about the personnel and staffing challenges that we're seeing escalate more and more every day. In the latest 24/7 survey on for salaries, and they update this information every year, but you see that average age of biomed climb every year, and the projections are that 25% of our workforce in HTM is going to be retiring over the next 10 years. Couple that with the fact that we've had numerous biomed school closings, and so the pipeline for people coming into the industry is significantly less. So thank you, David, for being part of that solution. So I want to call out some ways that that needs to be looked at differently, and so there's some resources that you can tap into. TechNation has an on-demand webinar that I did called HTM Skills Stratification, and that's focused on how to apply the right resources to the right work. So I encourage people to listen to that, and then in the upcoming AMI exchange. They call it AMI Exchange Rewired. I'm partnering with Danielle McGeary, and we're doing a session on succession planning. And that's not just for leadership, but it's succession planning for every single position within your organization. And I highly recommend that as well. And then again, going back to the fact that there just isn't the pipeline. People are going to have to look at alternative training options. The GE has developed an online course using virtual reality that people can lean on, and initially that was only available for GE employees, but they're starting to open that up more widely. Amy has a fantastic apprenticeship program that they just got approved. I think that's going to help out quite a bit. But no matter what's done on that side of things, I just don't think that we're going to be able to make up the difference. And so what's going to result, just out of necessity, going back to what we talked about relative to the benefits of the pandemic, what's going to happen here is that people are going to need to look at doing things differently. There's going to have to be a greater analysis of how your staff is spending their time, and finding alternative methods of doing the non-technical work. I started doing that back in my days at Aurora, and at the time, our annual device hours per technician was about what the industry average is now, Mike, which is about 1,000 annual device hours per technician. and we started assessing what our people were doing and how they were spending their time, one of which was parts acquisition, and determined that they were spending on average an hour per technician per day on the parts process. Found an alternative for that. We hired our own parts procurement people who offloaded that work from the technicians. And that, along with other administrative work that we went after, by the time I left that organization, we were at over 1,500 annual device hours per technician. So it's just looking at things differently, figuring out different ways to do things that applies your technician, more of your technician's time for what you hired them to do, which is fixing equipment. David, what are you seeing on the horizon?
Well, let me add to that, Al. I think you made a good point. I think the feedback we've always gotten from our staff for years is, I hate administrative work. Some will admit to they like going out and searching for parts, but they don't like being on the phone. They don't like doing some of the other research. And so for you to go out there and identify that as an issue and to find a way to get that off their plate, what a great way to literally increase, your satisfaction of your employees and probably keep them long term. So that's a great idea. Some of the other things I think we're starting to see in the industry, arguably this has been going on for years. A lot of people still say that IT is fairly new in the industry, but I can go back to the early days of 1990s, when GE and Space Labs and some of the other vendors were putting their stuff on a IT network. And so, we started identifying a gap of education for IT and networking for our staff, and we really started working on that. And of course, now that's segued into cybersecurity, which kind of gets into the IT realm also. But some of the other parts that's coming out now is the wearables. When Apple introduced their Apple Watch, I don't know what, probably 6 or 7 years ago, it's first generation type stuff, but now we're on 6th generation Apple Watch. The new Apple Watch does an EKG. You can download a PDF of your EKG. You can send it to your physician. So if you're doing some type of telemedicine, you could have an EKG that you could send directly to your physician so they could look at your EKG. And it does some limited analysis. I can't remember what the parameter it looks for, but it does do some basic analysis. There are also some other people have come out with some EKG, handheld EKGs that you can do that you can also send out to your physician. The latest Apple Watch actually will do oxygen saturation. It's taken mine all day long. So it's, you've got EKG and oxygen saturation that you can give to your physician or that you can closely monitor yourself. So I think wearables and or home medicine is going to be a big piece that HTM is going to move into, and the hospitals and or the BMEDs are going to have to learn to, it's not just the hospital they're going to take care of. They might actually be going into the patient's home and following them home to follow up with them on their health. And then, of course, the other thing that we've talked about for years, and Al, you really talked about this a lot, is data. You can't make good decisions without good data, and you can't have good data without a good database. Obviously, that's one of the things Accruent's known for. And so the BMEDs out there, they need to understand you have to have good, clean data. You have to have actionable data so you can give that to your executives so they can make good decisions, on whether we're spending way too much on repairs, we have high level of turnover on equipment, and or time back into cybersecurity on making sure our equipment is safe out there. So I think those are a lot of the big things that we're looking at. And one of the things you mentioned, obviously, too, is, we've got to get the education out there. And I applaud GE for doing some virtual training. Again, you could say the pandemic helped push that out to not just GE, but for everybody else. And I applaud Collin College for opening up a biomedical equipment technology program in the greater Dallas-Fort Worth area, which is greatly needed. We have a couple programs in Texas, but nothing in the metroplex of Dallas-Fort Worth, which is greatly needed. So I look forward to where we're going to take that program in the future.
Yeah, one of the other things that we haven't touched on, but I think going back to what came as a result of the pandemic is a much greater emphasis on financials. Um, Before the pandemic hit, the average operating margin for U.S. Not-for-profit hospitals was around 1.6, 1.7%. In the midst of the pandemic, those numbers dropped to -3%. So an average operating margin of -3%. And while we're sort of on the tail end of this, and there is some recovery, I will tell you that the leadership, the healthcare leadership that I've spoken to, have expressed that recovery has been slow, and so I would also say that right now is an ideal opportunity to go after some of the things that may have fallen on deaf ears in the past, or perhaps you've been reluctant to take on as a service organization, right? There's literally millions of dollars going out the door every day in rental expenses. And more often than not, it isn't because there's a shortage of equipment. It's because people aren't managing that equipment very well. They don't know where it is. There isn't a good process around it. So there's the perception of shortage, and that translates into having to spend additional capital to buy things that you likely don't need. Certainly it impacts patient care because you aren't getting things to the bedside at the time that it's needed. And again, the monthly rental expenses are killing organizations. And so, do you have an opportunity to help out with that? And again, I often thought about what our role is. Asset management really is part of it, and that includes not just the repair, but the overall management of those assets. And then if you go back and do some of the things that I talked about, increasing your annual device hours per technician, the cost of those administrative folks are less than what you're paying for your technicians, and having the good data to identify what your folks are doing, and knowing what opportunities are out there, and then leveraging that data will help you develop business plans to take on additional things like perhaps radiology services, right? That will help reduce costs. So, David, what are your thoughts on the financial side of things?
Well, I think you and I talked about this the other day. I think one of the big skills that are lacking in a lot of the HTM folks out there is good management skills and good financial skills. And, they probably have great technical skills because they've been in the field for a long time, but that doesn't always transfer over if you're moving up into management and wanting to manage a good biomed shop. And, you hit it on the nose where you're talking about, we have to find ways of helping reduce the cost of medical equipment service in the hospital. And that could be managing the inventory better, understanding where equipment is and how it's utilized, understanding what things are costing, whether it's imaging costs or rental costs or any type of other stuff that we're doing, contract costs. And, we need to find a way to get those skills out there so the people that are going to move into a management position in biomed understand that's a skill they need to possess. And arguably, that's the skill that hospital leadership is looking for them to do also. I think it's a great skill set. It's not something that's easily obtained. The way I knew that was a skill I needed to have. That's why I went back to school to get my business degree to help with that also. So I just think it's a big skill, and it's something that's lacking in a lot of the techs as they move up in the management position.
Hey, some great insight there. Just to kind of add my 2 cents in on kind of where things have been and where things are going, I just think we're seeing a really big acceleration in change that's coming up. I know pre-pandemic, we were starting to see more minute clinics and doc in the boxes and having to think of how can we maintain that in our industry. And I think this just accelerated us towards not only that, but towards the home health. And David mentioned the wearable monitoring devices that are out there. So our HTM groups out there now have to worry about maintaining equipment that's not as centrally located maybe as it was in the past. And then the inherent associated IT and HIPAA concerns that go along with equipment that's more spread out and coming in from other vendors like Apple and Amazon are both getting involved in healthcare now as well. So really interested.
And you can see, yeah, a lot of these companies, I mean, Google, Apple, Microsoft included, all the big players are, I know they've hired several IT executives or CEOs from some of the major healthcare systems in the United States. You know, I'm assuming they're doing it because they want to have healthcare better. I know some are doing it so they can reduce healthcare costs in their organization. You know, I think Google is doing a lot of that stuff right now. Microsoft just bought some major player. I think it's voice recognition software that's used in a lot of the hospitals. So there's a lot of the big name players are moving into healthcare big time to hopefully move the needle and make healthcare less expensive and better accessible for everybody out there.
David, you mentioned in your presentation at the MD Expo in Dallas, you touched on Intermountain Health's initiative to start up their own pharmaceutical company for a couple of reasons. First of all, getting access to the generic pharmaceuticals that people needed, and doing so at a price point that was affordable.
Yeah, that makes sense. I mean, you know, I've never been a big fan of think outside the box, but, you know, we're at that point to where you really need to start thinking of, you know, where are we spending our money and what can we do differently to reduce our cost and make it better for everybody, both our employees and our patients, right? So I applaud Intermountain Health for doing that.
All right, excellent points there. Anything that you want to add as far as what can the industry do to prepare for the changes that are in play, as well as what's on the horizon? Anything else that you two wanted to add?
Yeah, so, you know, I'll add HTM. One of the things I would like for us to do is sometimes we tend to focus too much on it's not medical equipment, I'm not going to touch it. And so I'll touch on 2 points that a lot of the biomeds don't like to do is nurse call and beds. And they think it should be somebody else. It's going to be contract, it's going to be facilities, it's going to be an outsourced company. And, you know, if we continue in HTM to give up these areas of expertise, you know, we're going to basically box ourselves out of a job. You know, I've been in biomed for a long time, and I was fortunate that nursing and leadership would come to me and says, we want you to do X. You know, we want you to do surgical lights. We want you to do OR tables. We want you to do this, and where we weren't traditionally doing that. And that's a good thing when leadership and nursing want you to come do those things, because they're looking at you as an expert to do those. And we can't turn around now and start giving that stuff away because we don't consider it medical equipment or we just don't like working on it. Somebody's going to fill that gap, and it's going to take away from us. And I know Al was really good about that when he was up in Aurora, is just expanding your horizons. You know, we've got to do that. We've got to continue to push the envelope of what type of things we can do with technology and those type of devices in hospitals. You know, and I argue, go back to our name. That's why they're calling us healthcare technology management. It's not just medical equipment. It's the technology in the hospital. How about you, Al?
Well, we touched on it a couple of times, David, when we talked about data integrity, and I'm absolutely baffled that there are still so many organizations that haven't implemented an AEM program. And at one of our client conferences, I called that question out to the audience. I first off asked how many people had an AEM program in place. And some hands went up, but I would have hoped that every hand went up. So my follow-up question was, for those of you that haven't, can you help me understand why? And the general response to that was, well, we don't feel that we have the data to support the decisions that we made around AEM, and so we just stick with OEM, whatever that is. We just do what manufacturers' recommendations are. And so I do want to call that out again. There's such a great opportunity there to, and I don't want to say save time and money. What it is it opens up the door for you to apply your valuable resources to things that have greater impact within the organization. David, you called out one, cybersecurity. Well, I don't have the bandwidth to do that. Well, you know what? If you had an AEM program in place, maybe you would have the bandwidth and other opportunities that we touched on. Doing equipment management, mobile medical equipment management, end of life, equipment disposition, things like that. There's just so many opportunities, and at this point, every minute that you can save by doing things more efficiently will help steer you toward doing things that will have a greater impact on your organization. So that's the one thing that I would say, that pay attention to your data. If you don't have confidence that you've got clean data, go down that path. Even if you have to outsource that some help to clean up your data. I know we do it. There are others that in the industry that help you with data cleanup. But when I talk about data integrity, it isn't just having alignment of your model numbers and manufacturers and device categories. I'm talking about documentation as well. Making sure that your request codes and your result codes and your fault codes are cleaned up, and that your staff knows how to apply each of them, so that everyone's documenting everything the same way. And that rich data is going to provide you so much information to make good decisions off of that. You're really, really limiting yourself if you don't do that. And my final thought on all of this, Mike, is lift up your head, right? It is hard sometimes. I always referenced it as being sucked into the whirlwind when you walked in the door in the morning, and you've got all of this stuff coming at you, and just getting your day-to-day done is a challenge, especially now. But you really need to take time to lift up your head and look at what those other opportunities are. And to David's earlier point, to take on these other things. I often stated to my leadership, I will do anything that you need me to do as long as I get the resources to do them. And so, like I said, be courageous, and don't be afraid to take those things on. If you think about who we all are in this industry at our core, we are problem solvers. And all of these things that are out there, the finances, the dollars that are being wasted, these are just problems, other problems that we can take a hand in solving. David, any last thoughts from you?
Well, I think you put a great way to say that is we're problem solvers. And I agree that that's what leadership looks at us. And I think when you said you go back to your leadership and tell them, I'll do anything you need me to do, just give me the resources. What a great way to, lift yourself up and your team up, but also let them, I've got to have resources to do this if you want me to do something. And go back to, again, what you said about the AEM, if you can't get the resources, this is a way you can reutilize your resources in a smarter way by reducing tasks they don't need to do, but let them do stuff they need to be doing, such as AEM or data cleanup. So I agree. Great points, Al.
Yep, that's near and dear to my heart. I'm a big supporter and purporter of data standardization and data integrity. And if you can standardize your data, then you can standardize your processes, and then you can make things more predictable and things will run more smoothly. It frees you up to focus on other areas that need your attention. Any
Exactly.
other final insight on this topic, Al, that you want to throw in?
I think we've covered it pretty well, unless you got something else, David.
No, I think we did too. I appreciate everybody letting me join y'all.
Hey, that's wonderful. Thanks both of you for your time and sharing your insight and industry knowledge during what's a very unique time for all of us. And a final thanks to everyone who's listening in. So have a great day, everyone.
Thanks, everybody.
Bye. Thanks.
Thank you, Al, David, and Mike for a great presentation. If you enjoyed today's episode, you might enjoy our ongoing webinar series, Webinar Wednesday. You can find a calendar of upcoming live webinars as well as an archive of on-demand webinars at WebinarWednesday.live. To obtain your certificate for 1 CE credit from the ACI, please remember to click the link located below this podcast title to complete today's survey. If you have any questions, you can reach us at webinar@mdpublishing.com.